The decision to demolish or refurbish housing has social implications, as well as impacts on health and well-being. The relationship between regeneration and health is complex. In this film, we look at improvements to housing, regeneration as a whole, and some of the other factors that have an impact on health and well-being. Evidence suggests that housing improvements on their own are probably beneficial to physical and mental health. For example, there are health benefits of living in warmer, drier homes. These improvements can be achieved through refurbishment or by building new homes. For regeneration schemes that don't just include improvements to housing, but also include changes to neighbourhood layout, to facilities or to the housing mix, impacts can be harder to measure. This is because, as well as changes to the physical environment, health and well-being are related to what happens to people during and after regeneration. An example of when it's hard to disentangle the health impacts of regeneration is when people are moved to a different place. If residents find that they're further from work or further from family, but in better quality housing, it can be difficult to single out the aspect that has the greatest impact on day-to-day life or on longer-term health. One study from Glasgow said that the things that residents thought were important about health and well-being were not just the physical condition of their housing, but the social systems and support structures that were in place in their local community and beyond. Other factors related to health and well-being include whether residents are excluded from decisions, or whether they face uncertainty about the future, or isolation as some people stay while others gradually move away, and whether residents lose confidence in the authorities if what is promised doesn't materialise. A case study in London found that improvements to a housing estate affected community pride, a sense of safety and relationships with other residents, but that these positive experiences also came from a long history of investing in and taking care of that place. The impacts on health and well-being of regeneration need to be evaluated case by case and based both on what residents say about their well-being and what health data show about the short and long-term impacts. The effects of these changes on different groups, young children, the elderly, single people, also need to be better understood when decisions are discussed.